Right. So I think, Alderman Force is really not only a fantastic leader within the city, but really a strong supporter of the innovation space. And you can hear that he speaks from the heart and really from a place of strategic intent in terms of us collaborating together. We take the innovation space seriously in terms of the potential and the responsibility it has to help us solve some of the biggest challenges on the African continent. That being said, it brings us now to talk about health tech. We have some phenomenal health tech winners from the Global Startup Awards Africa, and here today to engage, to talk, to showcase, we've invited some experts from our local ecosystem to engage with our winners. I would like to ask Dr. Simmery Ritt, who is the co-chair of Silicon Cape, the founder of the UCT Tech for Good Lab, and herself, the co-founder of a health tech startup, Nusi. Simmery and our panelists, if you'd please come down and join us on the stage. We are going to enjoy a good discussion around the future of health tech on the continent.
It's great to be here with you today. I think it's really fitting that the opening panel at the GSA Africa Summit is health tech. Word on the street is that health tech is the new fintech. However, what it says to us at the same time, though, is that while health tech may be the new darling of the investment and startup space, is also how problematic access to quality healthcare is in Africa. So the panel today is really all about talking about what is happening in Africa in terms of trends in healthcare. We'll also, though, be looking at things around challenges, constraints, opportunities, and then some personal words of wisdom, hopefully from our panelists, about what aspiring entrepreneurs can do in terms of the healthcare space. So it gives me a great amount of pleasure to welcome the panelists here with us today. And what we're going to do is we're just going to do a 2-minute introduction where each panelist can tell us a little bit about themselves, their startup, and or their organization. So I'm going to ask our first panelist, Mandy Swinepal, who is she heads up the HealthTech Portfolio at Wesgro, just to tell us a little bit more about herself. Thanks, Mandy.
Cool, thanks, Simmery, and wonderful to be here today with you all. I work for Wesgro. I'm the head of the health tech ecosystem in the Western Cape, and what we are passionate about is growing you guys, growing the startups, trying to navigate the ecosystem for you in order to ensure that you are successful, because your success is ultimately a success for our economy.
Awesome, thank you. So, Andrea, do you want to introduce yourself?
Thank you. Thank you. It's lovely being here. My name is Andrea Meghachev. I'm CTO and co-founder of Envision a Deep AI. It's an innovative medical company that uses artificial intelligence to analyze medical imaging, such as X-rays, ultrasound. We are starting to work in dermatology as well and other modalities, and try and solve the need for medical diagnosis through technology, through artificial intelligence, to speed it up and make it real time and accessible to everybody.
Fantastic, thank you. Chungu.
Thank you. Chungu Chama here. I'm from Dawa Health. We've been functional for 2 years now. And so what we do is we help, pregnant moms in the last mile find help at a very affordable rate. And we have our apps already out, but I'm the CEO at Dawa Health. And we are from Zambia, Lusaka.
Awesome, thank you. Ryan.
Hi everyone, my name is Ryan Rekovitz. I'm the CEO and founder of My Health.
I think this just, can you hear Ryan?
Can you hear me now?
Yeah.
So hi everyone, my name is Ryan Rekovitz. Not again. Let's try it again. Can everyone hear me okay? Can you hear me now? Yeah. Perfect. So my name is...
Oh my God.
Always tick.
Maybe I just hold it?
Yeah.
Yeah.
Okay.
Sure.
Let's just quickly see then, while we wait for round to be marked up again. Do we have any healthcare professionals in the audience? If you can just put up your hand. Okay, I see one hand. Oh no, I see more hands. That's excellent. Okay, so let's give it another try.
Can everyone hear me? I'm just going to take this one off. Can everyone hear me okay? Yeah. Right. So my name's Ryan Rinkowitz. I'm the CEO and founder of My Health. So the unfortunate reality is that every person in the room has obviously been personally affected, from an illness or themselves or with a loved one. And so that's why at My Health we're trying to make it really easy for patients to access healthcare services across the continent. So we work or assist patients. That's okay.
He's jinxed, right?
Hello.
I think let's just carry on the way we were, yeah.
So we make it really easy for patients to access the right medical specialist, where we work with all leading medical certified specialists in different countries across the continent and internationally. We assist patients to find the right medical service. We assist patients to get in-person appointment bookings, online video consultations, and remote second medical opinions. And we assist patients to find the right medical treatment. And that might be based on the expertise of the doctors, might be based on the technology and the treatment options available at the different hospitals. And so we work with leading facilities across the continent, such as Gertrude's Children's Hospital in Kenya. We also work with Aga Khan in Tanzania. We work with Al Salam in Egypt. We work with Reddington Hospital in Nigeria, and we're about to work with the leading hospital group in South Africa. And we also work with some of the leading hospitals around the world, including Bumrungrad International Hospital in Bangkok, Thailand, Acıbadem in Turkey, American Hospital in Dubai, and Apollo in India. And so we want to make it a little bit easier for patients that are obviously going through a very challenging time, just to make it a little bit easier for them to get access to that right medical treatment. So far, we've assisted about 22,000 medical visits to date, and operational in about 10 countries across the continent. And we're looking forward to scaling up our operations across the continent. Thank you.
Fantastic, thank you, Ryan. So to start off the panel discussion and debate, we thought that we would actually start with the main topic of this panel, which really is about looking at megatrends in healthcare across Africa. We're going to be asking Mandy Swinepal to start off the debate, really given Mandy's expertise and Wesgro's focus also on understanding trends, not only within the context, of the Western Cape, South Africa, but then really also the rest of the continent and even beyond the continent. So Mandy, I'd really like to put the first opening question to you around, what are the current trends that are affecting the demand, supply, and provision of healthcare in Africa? Thank you.
Great question. Thanks, Marie. So we've noticed that the trends obviously is everything digitization. So data, you are accumulating a lot of data. And what are you doing with that data? So I love this example of deep AI and what they are using the AI to connect with the health specialists as well. So it's not just having a tech on its own, but how do you humanize the tech with the people as well that uses it? So robotics is a big one. You've got precision medicine as well. Anything that takes the healthcare directly to the consumer, that is obviously a big global trend that we are seeing. So I'm only going to name a few. There are about 7 or 8 really big ones at the moment, but that's global. So what is the local trends? And I think just to comment on the trends is there are trends and then there's realities. And unfortunately within our local ecosystem, that the healthcare system doesn't always move with the trends. So the question really is how is your company targeting your market? And what trends are they implementing and are you going along them? So trying to upsell into the leading tech trends doesn't always meet the local demand or supply. So your timing with your client, your budget, your awareness, and your readiness of your market really needs to be along with the trends for your business to really flourish in the trend. So I would say note the trend. They are great to be aware of because things are moving in that direction. But as a business, what's your market and who's your client? Follow their trends, otherwise you're going to make life for yourself really hard as a startup.
I think let's build on that then. So I'm going to open it up to Ryan, Chungu, and Andrea. Based on what Mandy said, what are some of the trends that, are influencing the space that your health tech startup operates in? And then also, there's trends and then there's reality. So I don't know, I'm going to open it up and see who wants to give it a go. Andrea?
Well, let me talk a little bit about artificial intelligence and deep learning. It is a very popular, I would even say a sexy trend at the moment, with a lot of companies, a lot of research institutes, academics going into artificial intelligence and deep learning, specifically in the medical space, looking at imaging, looking at analyzing data, big data, and provide a lot of insight out of this. One of the bigger challenges that I've seen when implementing such technology in Africa is accessibility. In Europe, in the States, the infrastructure, the communication is readily available to deploy solutions such as these. Data centers are there, AWS, Azure, Google, all of those data centers and infrastructure is readily available. But when we talk about Africa, bringing that technology to the rural, to remote areas is challenging. And it is something that African startups are really, really good at solving. We understand those challenges, and we build our technologies to overcome those challenges and provide the impact to the people that actually need it.
Ryan?
Yeah, I think,
Anything from your side?
can everyone hear me now? Still not?
Or are you going to do this again?
Okay. I think one of the trends that we've noticed is that patients across the continent like choice on where they go for medical treatment. And I think that now more than ever, where people have access to the internet and obviously a lot of information on hand on where they should go for medical treatment, and we're seeing a lot of patients moving across the continent for medical treatment. And so that might be, a patient in South Sudan that has the option to go to South Sudan for medical treatment, might go to Uganda, might go to Kenya, might go overseas for medical treatment. In Burundi, they don't even have, unfortunately, an MRI machine. So a lot of patients that need that diagnosis or need that radiology services, they actually have to go to Uganda to get those. And so what we're seeing a lot is patients trying to have a bit more choice or taking more control of where they go for healthcare services, and that also might be moving across borders.
Yeah, I think what's interesting about what you've just said is also, building on that trend, though, part of it is that consumers in the healthcare space also now can choose whether to have these services delivered in their home, be that via telemedicine or in person, and that's certainly something that was accelerated during COVID, as we all know. So it's not only cross-border, it's literally also within, your own home. So Chungu, anything from your side in terms of megatrends that are influencing the space that your amazing startup is operating in?
Well, just to read on what they've said, mine would be about, it and its security. That has been a big factor. It's about if you can store data safely. That has been a very big factor that, that we've seen in our space. And so data can be accessed, but can it be stored, safely and effectively? That's what we have seen as the biggest issue. And I think, if we can find, rules and laws around that, that would be very, very, good. But that has been the biggest challenge that we've seen, and that, is a trend in terms of, trying to find the right, way of just trying to store data. That can be quite delicate, and we have to take a bit of, safety gaps towards that and how we can store it safely, data.
Okay, so then does anybody want to finish off the trends discussion, or can we move on to the next sub-theme, if there's anything else?
Maybe you should add.
Sorry?
Maybe you should add.
No, today I'm going to try and keep quiet, which is difficult, as you know. So I think, no, Mandy, I mean, it was just in terms of, what we've heard here today already in terms of trends. I think, and to your point, there's trends, and then there really is, well, what are we going to do about it? And realistically, does this also happen in our market? Because not all trends are happening in all markets, and specifically in Africa, what we do see, though, is that there are hyper-local effects even. So, it's not an entire country that's, for example, influenced by a trend at a micro level, even within cities and certain subsets of cities, if that makes sense. Certain trends may or may not occur. So I think it really is just about startups strategically looking at, is this trend actually relevant in terms of my startup? Is this something I should pay attention to? That's the only thing that I would add there. So I think then let's move on in terms of what is probably going to be one of the most dynamic pieces of this particular panel is really around challenges, constraints. It's really about the wicked problem thing, so which is healthcare. Okay, healthcare is what is considered a wicked problem now. For those of you that may not know, a wicked problem is a problem that is so complicated that it can't be solved by traditional ways of thinking. So what I really wanted to talk to all of you about today and to hear your opinions and hopefully have some lively debates about this is how are your startups actually trying to solve this wicked problem of healthcare in Africa? So I think what we'd like to start off with first is, well, what are the major challenges in healthcare in Africa? And I'm not maybe looking for the obvious here. We know that there are problems around accessibility and affordability to quality healthcare. I'm looking for a slightly deeper level of critical thinking here about what are some of the other challenges that make up this wicked problem. Okay, so I think I'm going to open it up. I'm not going to ask somebody to start specifically, but I'd like to put it to the panel and to say, what are these major challenges that make this problem so particularly wicked? Who wants to have a go?
I'm happy to go first.
Great, thank you,
I
Ryan.
think, yeah, definitely, what Chengu was saying is that access to sort of patient data is a huge problem. So a lot of patients, when they go to their local hospital, get diagnosed, the local hospital will not give them their medical reports or their scans. And that's a huge problem because that doesn't allow patients to have choice in getting a second opinion. It doesn't allow them to potentially go to other hospitals. And so just trying to figure out how to ensure that all patients get access to all their medical records, their medical reports, and they can store them on one platform. So on our app, they can upload all their medical reports, they can share it with different doctors so that they can take a bit more control of their own health. Obviously, some of the challenges around that is in terms of country-specific regulations when it comes to patient data, and just ensuring that all patient data is mapped locally to a local server. So that does create some challenges, but I think that number one is probably the biggest one to ensure that patients can have a bit more choice on how to get the best medical treatment. And I'd say number two is just getting doctors to talk in collaboration. So I think that there's phenomenal doctors across the continent, and getting the doctors to talk more and getting them to share best practices, getting them to discuss technological trends, and getting them to really sit in on some of those more complex cases. And that's why we're also trying to create an expert network where doctors can speak about complex cases, they can share those best practices, have online CMEs, and we also link them with some of our experts overseas one thing that we're trying to do is trying to encourage the top oncologists at the overseas hospitals to sit on tumor boards once a week, just so that they can share their expertise on some of those more complex oncology cases. That's really getting people to collaborate more across the continent.
Cool. Thank you, Ryan. Andrea, Chengu?
I would add to some of the challenges, the challenge of education and knowledge, not only with the patients, but doctors and medical practitioners. We are talking about megatrends here, and we mentioned artificial intelligence, data, big data, travel, and being able to travel from one country to another country for a medical exam. A lot of the patients need to understand and be put at ease with the different things that we are proposing as the startups, as a medical community, as the hospital groups. So patients and doctors are understanding all of this innovation, all of these technologies and different procedures, new groundbreaking procedures that we are offering, and there is less rejection of the technologies and the innovation that we are bringing into this space.
Absolutely.
Yeah.
Mandy,
Shunga.
Chengu?
No, you can go.
Yeah.
I'll add
And
just
so just to add, yes, that is actually a very good point because some people need to, learn about this, about the check going out because there is a bit of resistance, because I think if we can, preach about it a bit more and, put it out there, people can actually accept because I've seen trends whereby, tech goes out, but then people don't really know too much about it and they can, resist it. And that has been a very big issue. And so, we must try and, preach about it more and, bring out the good things about what this tech that is, out there is doing. And then we can have folks that would, see it for what it is and see its goodness for just that. And so I think we have to try and, push more towards, pushing out this tech that we have and what it's meant to do. And it will be, perceived better out there once it's gone out. I think we just have to work in that direction. That has been a big factor. I speak from experience, actually. This is what we've seen. back home, and I think that would be very helpful if we were to work towards trying to preach more about this tech and how it can help others, and there'll be less pushback and more goodwill.
Cool. Mandy, anything from us?
I mean, we can go on very long, have a long discussion about the challenges in Africa specifically. And I think one of the sad things for me is that the system is so disconnected. So from the service provider to every different area, like you've mentioned, the micro cities, in between the systems, they do things differently. So there isn't a standard operating procedure for health globally. There certainly isn't one in South Africa, and there isn't one in Africa. And finding your way, navigating through that system, understanding how is procurement done, how do I reach the doctors, how do I sell my solution to who do I need to sell my solution in order for it to be considered. So having things tested and sold are two different processes. So if you want a proof of concept to land with in a facility, just for them to give a okay or a good thumbs up on your idea versus I'm actually procuring the system are two different systems. So understanding where should I go, who's helping me navigate this ecosystem, there isn't a booklet that or someone that can really walk that way with you or that journey with you. So that's major one that I'm seeing for local and Africans as well. And I think one of the key points that I picked up recently with the Aspen and Johnson & Johnson case for the vaccine production, some key insight that came out of that article was that Africa is not buying from Africa, very seldom. Africa is still very much reliant on philanthropic donor organizations to sponsor the services that they need and sponsor the whole solutions, not just the consumables. So with that in mind, you have to ask yourself, who is buying for the system that I'm trying to sell to, and how do I access the actual buyer? So do I need to go speak to Bill and Melinda Gates to sell my solution? Are they even considering my solution as a priority for them to fund or invest in for Africa? And how do I find those funders and supporters of the system that I'm trying to sell within the system? So understanding who's out there and who's doing what is a really like dig and find for yourself as you go along. And I think that's so frustrating for startups, is if you had a roadmap that could just make things a little bit easier, where would our system be?
Yeah, no, definitely. And in listening to what all of you have said, it also just reminds me of the importance of, the ethical and social responsibility that all of you carry actually as people in the technology space, specifically in healthcare, to make sure that we are delivering services in an ethical and socially responsible way, and that means honoring things around privacy, security, dignity, so, and I think what sometimes worries me tremendously is that when we design these technologies, we don't design them actually with the right people in mind, if that makes sense. So, for example, in artificial intelligence, and Andrea, you'd know more than this about me, but much of the coding is actually not done, for example, in Africa, yet we have to deal with implementations here that are then designed by people who maybe don't actually even understand our context. So I think what comes up for me often is this thing of we really need to think about how we can do this responsibly. So that came up for us recently. And then also one of the challenges that I just wanted to discuss with you today that we've been seeing from a Nusi Health perspective is really, and it's deeply concerning, is the outflow of medical professionals from South Africa. Now, I cannot comment about Ghana or any other country right now, and maybe, Chingu, you can tell us about it. But what we keep on wondering at Nusi Health is, well, if we don't have enough medical professionals to deliver the services that all of these startups are aiming to deliver, I'm not quite sure what one is going to do, and will we become even more reliant on technology then? So my question to you is, do you have concerns around this outflow of, and it's everything in terms of medical professionals. It's doctors, it's nurses, it's physios, because our medical professionals are of such a high quality that they're literally being poached by other countries offshore, out of continent, because the working conditions, the pay, and some of the other unfortunate realities of where we are, make it very unattractive for our medical professionals to stay. And I'm laughing, not because I think it's funny, it's actually deeply concerning to me. So, but I see Mandy smiling, so I'm laughing now. But yeah, I would just like to put it to the panel, and what is your opinion on this drain of professionals that's busy happening? Anyone want to go? Go?
Yeah, absolutely. So I completely agree with that. I think Nigeria is probably one of the countries most affected by that. They have a huge number of doctors, and I don't quote me on the figures here, but I think it's something like 95,000 registered doctors, and they have about 60,000 actually practicing. The rest have sort of gone overseas for higher paid positions there. It's a huge problem in Kenya. It's a huge problem across the continent, and that just basically leads to a lack of choice for patients, and causes a lot of problems. Completely agree on that.
Are you seeing the same thing in Ghana, Chungu?
Well, in Zambia,
In Zambia?
to some extent, but then I think we have to, because doctors are, we can't, take them out of the hospitals. Like, we need them. And I've got concerns about that because I think they should be, in the hospitals. It's about, can we improve the, terms of work? If we can, then we should do it clearly. But then if we can't, it's about where can tech fit in. It is a sad case, but then we have to, think ahead of times. But there's some that we just can't simply change, and probably doctors we can't necessarily, change them. And so we have to improve their terms of service, but also where possible, tech can come in and actually assist, because we are so far along now that I think for some particular roles, tech can actually fit in, and things like probably data storage. Tech can actually do that well, but there's some roles that we still need to have, doctors, nurses, and the pharmacists, because they just add that extra care, and that you can't take away. And so I do have concerns about that, and we have to, work around that.
Mandy?
Don't get me wrong, maybe I'm just a little bit too optimistic here. So it is a serious case. Doctors are leaving, and we are seeing this as a major concern in the industry. But with the megatrends, everything is being digitized. I mean, if a doctor can sit and work from anywhere and literally anywhere, how can we use that opportunity to then bring them back? I think South Africa and Africa certainly has something to offer that the rest of the developed world does not have, and we love solving problems. And when things are already set and developed, there's nothing to solve. So there's that need to innovate that always remains within the South Africans. Even if they leave, they come back wanting to solve something for South Africa. So I've seen that, and I've engaged with some of the doctors saying, what are some of the challenges that we can help you solve, and how can I work from Canada and solve something in South Africa? So with digitalization, the world's going to become open to still employ those specialists, hopefully, all the doctors that's leaving, and we can make it attractive for them to help our systems with platforms such as Deep AI.
I think then let's leave that sub-theme on that positive note from Mandy. And I think the one thing I always get asked, and I think I'm going to put this to the panel, it was a question that we were thinking of asking, and I think it's what many of us wonder, is this a sustainable development goal around quality healthcare for all? It feels, and depending on whether you're a pessimist, optimist, or a bit of both, it feels terribly utopian in terms of potentially achieving it, idealistic in an unachievable way, potentially. So the question to the panel today is this sustainable development goal around healthcare realistic, or are we actually asking the wrong question here? So I'd like to put that to the panel. It's not a trick question, by the way. We'd really like to hear your opinion in terms of, do you think it's realistic, or should we be asking something different? Who wants? Andrea, you seem to have something, thing in your mind.
I wanted to say that all of these idealistic goals and ambitions, that's what drives us, the startups around here, to innovate and create the solutions and create something that we may think utopian, but bring it closer to reality. Create something that makes the world a better place. To give you an example of where our startup was driven from, my partner in business, she's a pediatric radiologist, and she's done a lot of outreach work into Africa. And some of the numbers that she was quoting was alarming, it was scary. There are 20 pediatric radiologists on the continent with 500 million children. How do those children get to see are qualified as specialist radiologists, a pediatric radiologist, and it takes 14, 15 years to qualify as a pediatric radiologist. We just can't produce as many pediatric radiologists on this continent to fit or fill this demand. So our utopian, idealistic desire is to use technology to bridge this gap, to give the healthcare that all of the children on this continent really deserve. And we'll keep on doing what we are doing, innovate and knock on the doors and bring our solution to all of the people and the players that we can to bring this dream a reality. And, you know, this passion, this belief in utopia is a great driver for innovators, for the startups.
Absolutely, it really reminds me of something that I read recently, which is called Beyond the Impossible. And, you know, I think this striving to make a difference or disrupt this current state of healthcare in Africa really reminds me of that, because it is literally about going beyond the impossible. And it really is about, you know, exactly what you've said, Andrea. At least I agree with you personally in terms of, but this is the stuff that inspires us. It's these wicked problems that seem so impossible to solve that are the very things that give birth often to incredible startups that may potentially become, you know, Africa's next unicorn, which would be quite incredible. So, Ryan Chinga, do you have any other thoughts on this particular question around, you know, is it utopian? Is it unrealistic? How do you feel about it? Does it inspire you?
It definitely inspires me, but I do feel that the private sector can only go so far. I think it needs to be a collaboration between the private sector and the government. The government definitely needs to, the governments in different countries obviously need to take on some responsibility. Kenya's doing a fantastic job. They've recently launched the National Health Insurance Fund, where, you know, for $5 a month, you can get access to health insurance, and you can go to sort of a lot of different hospitals across the country. And then you also get choice on going to private hospitals as well. So I think if governments can step in and provide a safety net through some sort of insurance mechanisms, and then the private sector can step in and fill those gaps in between, you know, providing technology and providing access to different healthcare services, I think that those goals can be achievable.
I think you've just mentioned something else that came up in some of our research, which is this whole theory of collective intelligence. And maybe, Mandy, you want to add something in here, is it really speaks about the fact, and I know that Leslie also mentioned it in the opening welcome, is this thing of the fact that we actually need a whole number of role players working together to be able to tackle a wicked problem. So it's not exclusively the domain of, you know, the private sector or startups. It's literally, they say, it's a collection of business, government, society, and academia. I don't know if you want to comment on that, Manny. Would you agree that the sort of collective intelligence approach is something that should be leveraged in this space and could actually make a difference? Or is that, again, in itself utopian?
It has to work together. If it doesn't, we're never going to solve it. It's too big of a wicked problem for one player to solve. So without vision, people perish. And I agree that we need that vision. We need that goalpost to really aim towards. And health is such a dire need of fixing. And whether we're going to fix it or just create an alternative solution that offers patients a way to receive what they are rightfully should be receiving. So, yeah, I think it's a tough one. And in South Africa, for instance, we are struggling with mandates. So you've got the economy builders, but you've got the healthcare system that worries about patient safety and quality and efficacy. So they don't worry about how it's growing their economy. So they don't care if it's local or not. They just need to focus on the patient. And when you've got DTI focusing on, we need to build the economy along with it, those two are constantly competing. So our efficiencies in health isn't concerned about a startup's need for making profit. So these things really need to come together, and we all need to be on the same page to say, how do we all make our role different in the ecosystem?
I think then that we do need to leave some time for the audience to do Q&A, but there are two things that I'd like to do with you before we open it up to the audience. So the first thing that I'd like to put forward to you is the fact that there are many aspiring entrepreneurs here in the room, and this is also about sharing wisdom. So what I wanted to ask our three startups, and I'm not excluding you purposely, Mandy, we'll get you on this, okay, is what is the one piece of advice that you wish someone had given you before you created your startup? And I'd like to start with Chungu.
You know, like it took us a very long time to actually build the product. I think if we had launched it out early and then tested it very, very early, would have known, things that we now know. So that is my biggest regret also, and it's a confession here that we took too long to, build it quickly. And so just start and, take it out fast and, build and build and build. So don't take time, build it out, test it out and get feedback, because what you're trying to build is not for you. And so take it out there quickly, test it, and it will get better.
Ryan?
I would definitely say focus on your user. So don't worry about all the other noise. Don't worry about what your competitors are doing. Just focus on your user. So in our case, it's all about the patient. You've got to focus on what they need. You've got to focus on building solutions to what they need, and just figuring that out and continually to iterate, collect feedback, iterate again, and again, just solely focus on your user.
Yeah.
Andrea?
I would say start looking for a customer as early as possible. Don't wait until you build the solution and you build, you test, you got all the regulatory approvals and everything else, and then only then you start looking for a customer. Finding a customer takes time. So when you start building, conceptualizing, whatever it is that the startup is building, at that point in time, start looking for a first customer and build that solution together with a customer. So by the time that your solution is complete, your prototype is complete, you already have a user, and hopefully a paying user to pay all the salaries and the costs and everything else of your startup.
Mandy, anything you'd like to add here?
Yeah, I think your team. Make sure that you have the right team in place, because going solo won't take you far. But having the right team in terms of sales, legal, the entrepreneur and the finance covered will definitely take you the journey.
Yeah, I think the team thing for me is extremely important, and certainly something that we've seen in our journey also to date in the startup space, is how important the people around you are. And then the other thing that I would just add on top of what you've said also is fail boldly. I read something the other day from a female entrepreneur, a South African entrepreneur, and she said, failure is not the opposite of success. Failure is part of the recipe for success. So I think for anybody here today who's thinking of doing this, I would say don't be scared of failing, because it's in failing that we actually succeed, if that makes sense. And I'd imagine that all of us, Ryan, Chungu, Andrea, Mandy, we've all failed in order to succeed ultimately. So don't be scared of failing. And I think that's part of the wisdom that we can share with aspiring entrepreneurs here today. I think then, before we open up to the Q&A for the audience, I would just like max 1 minute closing thoughts from each of our panelists, and I think let's maybe do it this way this time. So Ryan, some closing thoughts from your side.
I personally think it's a really exciting time for the health tech space. I think a lot of innovations happening across the continent, and just really looking forward to seeing more collaboration between the different sort of innovators. And I'm really excited for the future. I think that we can definitely make a lot of progress on meeting the different goals, and also working with governments. Yeah.
Cool, thank you, Ryan. Chungu.
Yes, just the same thing. I think, this time is actually very exciting, and we just hope to see that we all work, as a team, and we can do things that we don't even think about. I think there is, tons and tons of potential if we just, keep at it and get it done.
I'm actually excited to see people. After 2 years of staring at initials on the screen and not being able to interact with people, seeing people smile, laugh, collaborate, joke, and brainstorm certain ideas and concepts. This is so excited, and I'm so glad that we are coming back, we are turning around, and the new normal that we were talking about is actually going back to human interaction. This is beautiful. This is so exciting.
Absolutely, Mandy.
I want to say well done. Well done to all of you startups for you innovating, because we certainly need your innovations if we're going to ever make a difference. The road is sometimes a little bit rough, but be loud. Speak about what you're doing. Be out there. Let people be aware of what your solutions are, because it will pick up traction. and just be loud. I love it. Loud and get them on board. Be loud and proclaim what you guys are doing. And just round of applause to you. You the heroes.
Awesome. Thank you. Thank you, Mandy. So we've got about 4 minutes available for Q&A. Because of COVID regulations, we can't pass the microphone around, so you'll see there are 2 standing microphones over here, and if you wish to ask any of the panelists a question, now's your chance. So just go there, and then you can ask them what you'd like to. Any questions? Okay, we've got a question coming. And please just direct it at a person or to the panel in general. Hi, man.
You sure? Don't take this shirt that I'm wearing that I'm a setup. I'm not. It's a gig thing, but I have my own questions. Very impressive. Thank you very much. I was so happy to hear that all of you are to do with technology, yet all of you spoke about people and teamwork. Because invariably, artificial technology cannot inject a patient with a COVID vaccine. Okay, a person has to do it. So you have huge challenges, and one of those challenges, of course, is to keep, as you were saying, the doctors, the nurses, and so on and so forth. And I spoke to all of you, so I know what your problems are. And you briefly talked about a little bit about national health. Now, I don't know how many English people we have here, or I don't know how many French people we have here. They're not very happy with the system they've got. And this continent is too big. And one of the things that I've taken back is that you're not really relying a lot on the major insurance companies, okay, to provide certain help, certain, if you will, financing, or even being able to offer certain insurances to everybody at an affordable rate, because believe you me, the insurance companies can afford to do that. Are we doing anything about that? Are we going after, I mean, I'm going to ask you two first. Sure. Are we doing, I mean, come on, let's make them feel guilty. Okay? We're talking about, we talked about Africa, we talked about what a wonderful place this is. Are we making the insurance companies feel guilty to come back and say, okay, you know what? Yes, in Europe we charge $600, okay, per month for insurance. Well, let's offer this to people for 20 or 30 or 40. And then I'm very proud of you, Andre, that you said, I don't need the doctor sitting in place, because with my system, the doctor can be sitting in Timbuktu and they can still do it. So good job, that's very good. But that was my main question, is how are we pushing the insurance companies?
Okay. Anybody want to take that question?
If I can comment first there on it. So I think in terms of South Africa and the national landscape, the health compliance competition really shed a light on what's going on with the insurance. So that is a step in the right direction. And I am aware that National Department of Health is working with every role player, both public and private, to look at a solution that is possibly more doable in terms of universal health coverage, whether it's affordable. That's the long discussion that they are still figuring out. But they are speaking to the role players. So it's everyone's responsibility to make healthcare more affordable and more accessible in South Africa, and finding the right loopholes. I know there was a thing against health insurance, but medical aids were around. But now that's changing. So the policy around whether you can have a health insurance has changed. So those are positive changes towards a system that can be there and available to cover everyone.
Just to add to what Mandy was saying, we find that the health space, together with the insurance, the medical aids and everything else, is so disjointed that before you start the conversation with the insurance companies, you need to bring all of the players together and have that conversation together and make possibly everybody in that room feel guilty and do something about the problems and the challenges that we are facing.
Sure. Absolutely. So any other questions? Time's up apparently according to this board, but let's just see, is there there's a question, go for it, Will.
So it's Will Green from Grindstone. I know you entrepreneurs have sacrificed a hell of a lot to be here. So I just wanted to give you the opportunity as to kind of what would success be for you from this awards, apart from not winning the award, but it would just kind of explain to us exactly what success would be, and obviously giving each an opportunity.
What would success mean to you? What would it look like? Or are you already, do you feel you've already achieved
From
it?
this event, when you see
From
people, what
this
do you
event.
want to achieve? Obviously, you've sacrificed a hell of a lot to be here.
Funding, mentorship.
I mean, I think all of those things, but also just hopefully encouraging other people to also give it a go. Starting a business and entrepreneurship is extremely tough. And yeah, just hopefully other people take that leap and give it a try.
Chungo?
And for us, it's just about impact. And so we want to have, a very high impact. And so that's what is close to our hearts, the four of us now. And just trying to, assist as many moms as possible. That's our goal. And what we hope is we will do that very soon.
Cool. Andrea?
I think it's twofold for us, for me. The one is to have this conversation with fellow startups, with fellow innovators, to understand their challenges and how they overcome those challenges, but also share our message, share our desires, our challenges, and how we solve those challenges, and make a couple of connections. I have a couple of familiar faces from this event on my LinkedIn, on the feed, and, see the news coming in, months and years to come from this event.
Absolutely. And Mandy, for you, as the owner of the HealthTech Portfolio at Wesgro, what would success look like for you afterwards?
Connections, collaborations, and more funding. Certainly. If we can attract more funders into health, global investors, it's a win. More collaborations locally and just building real connections. I love that. Makes a
Fantastic.
difference.
So our time really is up now. And I think just, if we can just give a warm round of applause to the panelists. Thank you. Thank you.
Well done, guys.
And then also, I would personally like to thank Mandy, who has actually sponsored this panel through her HealthTech Portfolio at Wesgro. So Mandy, thank you.
Pleasure.